Good morning, everyone. My name is David Pokhrel, and today's topic is e-learning in healthcare setting for nurses. Moving forward with today's presentation, the agenda consists of a quick intro into e-learning, a background on a study reviewing the enables and barriers, the research design, any ethical issues or concerns, what the findings were, and then my final thoughts. We will, of course, then also open the floor up for discussion. As we all are aware, technology is quickly advancing in healthcare, which means that there will be new ways to deal with illness in individuals. In healthcare, e-learning offers advantageous ways for healthcare professionals to stay up to date with the latest advances in diagnosis and treatment. Continued education in healthcare will always be around and brings about success for those in the industry. E-learning is the best way to keep medical staff educated, knowledgeable, and skilled to provide excellent care to the patient. It is important to understand the impact on e-learning in healthcare setting. COVID-19 has brought e-learning more to the surface recently. As I spoke briefly about benefits that e-learning bring to healthcare setting, but what are those benefits? E-learning provides conducive to all types of learning, whether you learn best by reading, listening, or visual aids. Learners can educate themselves at their own pace. Absorbing the information provided in training is necessary, and with e-learning, healthcare professionals can find an avenue that can be taught best in. E-learning provides a database to turn to when questions are presented in a timely manner. Search engines allows for easy access to unlimited information. Healthcare facilities may use e-learning systems to provide important news to employees. This method is also less expensive. Users already possess learning materials via access to computer or smartphone, which also means that e-learning can happen anywhere. Moving forward, the research article I chose uses a systematic review of articles that were published on e-learning in health sciences from 2005 to 2019. 985 records were identified, 162 citations were screened, and 57 were found relevant, and 2355 participants in high-income regions. The study looked for barriers and enablers with e-learning in health sciences education. E-learning has become part of the mainstream in education. However, little is known in regards to what works, when and how e-learning improves teaching and learning. Enablers consisted of the following, like facilitated learning, learning in practice, systematic approach to learning, and integration of e-learning into curriculum. Barriers, on the other hand, consisted of the following, like poor motivation and expectations, resource intensive, not suitable for disciplines, and lack of IT skills. Evidence also found that supporting of instructional design and delivery mechanism influences the overall learners. As you can see, while there are still needs to be interaction and collaboration, e-learning is flexible, learner-centered, customer-focused, and with individualized learning and styles, including collaboration, cost, and integration. It is a blended learning experience and has best in terms of healthcare, which consists of face-to-face and text-based internet interaction. Things that may make e-learning ineffective are whether there is an appropriate policies and strategies, inadequate resources and trained staff in place. As far as healthcare is concerned, you need hands-on experience and practice and instruction from facilitators is recommended. In addition, lack of IT development could cause the concept of e-learning to be ineffective. This study also helps us to show that e-learning models, design, and components can either be used well or used poorly, based not only on those said items, but also the users themselves. Moving forward with the presentation, here we can see limitations in the study that involve the fact that there were no gray areas of literature research, meaning specifics only were used. No additional data from others were asked for, therefore there could be bias. Finally, one third of the studies provided inadequate descriptions of methodologies, and again, open to bias. Moving forward with our presentation, several studies literature reviews were examined. The following similarities and differences were discovered. On the similarity section, flexible, versatile, and economic. And on the differences, we can see blended environment needed, niche management support, and was not idealistic. The literature reviews I examined all seems to be somewhere on the same page that e-learning in healthcare works because it is conducive to lifestyle in a fast-paced environment. It is also debatable with the need of blended environment like face-to-face or online. All studies end with need for further or future studies as we look into the design and overall delivery methods. Systematic literature review, also known as SLR, designed to locate, appraise, and synthesize the best available evidence and provide informative and evidence-based search area. The overall search was performed in Medline, Embase, Allied and Complementary Medicine, DS Data, PsycInfo, KineHealth, and Global Health from 1980 to 2019. During this overall project, the primary search terms that we were using in e-learning were different terminologies, including for some health science education, like text word searching, or either phrase appearing searching or Boolean search functions were used. Some of the Boolean operators and functions such as learning or online learn or distance learn, or either you can call computer assisted instruction or web-based learning or internet-based learning or multimedia learning, and basic sciences were used in overall research design on the terms of key terms. As we move forward, we can see qualitative and quantitative research studies were used. The study design included randomized controlled trials, non-randomized controlled trials, controlled before and after studies, and controlled interrupted time series studies. Focus studies were used involving e-learning implemented in health sciences, education, specifically the barriers and enablers, including primary data. It excluded criteria, includes studies that did not include LHSE and those that did not examine barriers and enablers. Review papers were also excluded. Overall, two reviewers conducted the literature review to ensure quality assurance. 5 stages of data screening occurred, including electronic database, title, and abstract review. Manuscript review, review of references listed on the papers selected for the study, data extraction, and quality assessment. Here we talk about data categorization and analysis. As we know nowadays, the size of overall data that is being generated and created in different organizations is increasing drastically. Hence, after having collected the data from different sources and stored them in various databases, we can proceed to many analysis steps in the aim of extracting hidden information and discriminate patterns. As you can see, this figure illustrates an example of what we call the advanced analytic and its components. Indeed, it contains descriptive, diagnostic, predictive, and prescriptive analytics in overall phases. During the descriptive analysis stage, which is the first step of our analysis, a global summary of the data yields to create a historical view on data and prepare them for overall future analysis. Moving forward, this analysis also uses illustrative figures such as histograms or pie charts or tables, and the user can easily interpret an overall hidden information. The diagnostics analytics, on the other hand, is the next step of the analysis where more functions are performed, and the predictive analysis is used for making prediction for future values and also is helpful for identifying unknown events. Overall, it is the most important stage of the advanced analytics since it involves very sophisticated methods of machine learning and data mining. Finally, as we move forward, prescriptive analysis is the last step of an advanced data analysis where it consists the application of the predictive model to determine the best solution or outcome among various choices. Given the known parameters in this phase, not only it is predicted that what will happen in the future using our predictive model, but also it is shown that the decision maker can make the implications of each option. As we all know, systematic literature review, SLR, studies are looking at previous studying related to the topic of interest. A guide for ethical assessment in SLR should be considered, and it is one of the most vital steps that all the organizations should be more mindful of. A statement that relates to potential conflict of interest should be present. In addition, as far as the studies used, were there any publication bias where some were unpublished or includes bias? That is a vital question. Informed contest involving the gathering of participant information must be present and adequate steps taken to prevent unauthorized access to personal data. IRB approval from the ethics community was present. Throughout this overall literature review, I came across several studies with similar outcomes. There is evidence that shows e-learning effectiveness in health science education, also known as HSE. E-learning effectiveness in HSE also recommends that each study that I reviewed appears to have overall common factors. The concept is flexible, low cost, easy to use, efficient, and conducive to many. But also there are barriers to this type of ELHSE where healthcare needs to be hands-on. Therefore, a blended educational education experience works best. For e-learning to be more or very effective, you must make sure that IT skills are present and there is motivation behind learning. There does need to be further studies investigating technology advancement in overall HSE and to look at what design and delivery method will be most effective. As I stated before, further research needs to be performed and focused on the overall delivery and design of ELHSE. What type of e-learning works best for HSE? What IT hardware and software are necessary to create an effective learning environment? Are there motivators? If so, what are they? Does ELHSE work up to a certain level of education and then need assistance? I would also like to focus more on what degree of ELHSE really works in medical field. Also, do overall demographics play a role in effectiveness? Talking about grants. Grants will help to hire research assistants, undertake research with technological support, participate in conferences, and will be productive. Obtaining a grant will provide opportunities. With grants, we can find ways to improve ELHSE and, in turn, improve patient safety and care. Through research, we can innovate the delivery of healthcare and understand better of what is really needed. We need to continue to improve the way we provide educational opportunities to those that need it the most, that are our frontline heroes. This concludes my presentation for this afternoon. At this time, I'll open the floor up to you, and please do let me know if you have any questions and discussions. I'd like to thank you all for taking your time to be a part of my presentation.